The grand ballroom at the Fairmont Hotel sparkled with crystal chandeliers as Boston's medical elite gathered for the annual Children's Cancer Foundation Gala. I sat quietly at our reserved table, watching my family mingle with distinguished physicians while discussing their latest professional accomplishments and charitable contributions. The Martinez family has always understood the importance of supporting pediatric medicine, Dad was explaining to Dr. Richardson, the hospital board chairman. His voice carried the authority of someone whose surgical reputation had opened every social door in Boston's medical community. When you've dedicated your career to healing, giving back becomes a moral obligation. Dr. Richardson nodded approvingly, clearly impressed by Dad's charitable commitment. Your donation to the new children's wing has been transformative. It's physicians like you who make real differences in young patients' lives. I sipped my wine silently, accustomed to invisibility at these gatherings where my family showcased their medical prestige. At 26, I'd perfected the art of blending into expensive backgrounds while they discussed surgical innovations, all while dismissing my own medical situation as insignificant. Speaking of family dedication, interrupted Dr. Patricia Whitman, whose opinion shaped Boston's medical society, I understand congratulations are in order for Elena's successful appendectomy. Such a relief when these routine procedures go smoothly. My sister Elena beamed with satisfaction, her post-surgical glow enhanced by the expensive dress Dad had purchased to celebrate her brave recovery from what had been a standard laparoscopic procedure. Thank you, Dr. Whitman. The medical team was wonderful and Dad made sure I had everything needed for proper healing. Absolutely, Dad interjected, adjusting his platinum cufflinks with pride. When your child needs medical attention, you spare no expense. Elena's recovery required a month at our Nantucket house, ocean air and complete rest. The irony was breathtaking. He'd purchased a $2 million beach house to facilitate Elena's recovery from routine surgery while dismissing my weekly oncology appointments as unnecessary drama and attention-seeking behavior. Poor Sophia has been having some anxiety about routine medical checkups, Elena said with mock concern, glancing at me with condescending sympathy. You know how some people dramatize simple doctor visits. The comment was designed to emphasize my supposed hypochondria while highlighting Elena's mature handling of actual medical treatment. What she didn't know was that my routine checkups involved aggressive chemotherapy for stage 2 lymphoma. Just doctor visits for drama, Dad added with paternal exasperation. Some people need constant medical attention to feel important. It's quite exhausting for the family. Dr. Whitman's expression softened with sympathy for Dad's apparent burden, unaware that my anxiety was actually terror about surviving cancer that my own father had dismissed as insignificant. What made their performance particularly remarkable was how completely they'd rewritten my cancer diagnosis as a minor inconvenience requiring family tolerance rather than support. They'd spent 8 months treating my lymphoma as a psychological problem while celebrating Elena's appendectomy as a major medical crisis. Tomorrow's surprise appearance by my oncology team would provide an excellent opportunity to clarify exactly which medical situations actually qualified as dramatic. The gala continued with familiar elegance, medical professionals discussing breakthrough treatments while raising funds for pediatric cancer research. My family moved through conversations like established philanthropists, accepting praise for their charitable vision and medical expertise. The Martinez family exemplifies what we hope to achieve in medicine, announced the foundation president. Their combination of surgical excellence and charitable giving represents our community's highest ideals. The applause was enthusiastic as Dad stood to accept recognition for contributions totaling over $500,000 to cancer research. Ironic given his dismissal of my actual cancer as medical dramatics. Over the following weeks, Elena's appendectomy recovery became the family's primary focus. Dad arranged private nursing care, hired a personal chef for specialized meals, and scheduled daily check-ins with her surgical team. Every comfort was provided for her healing from what had been a 40-minute outpatient procedure. Meanwhile, my chemotherapy sessions were treated as inconvenient appointments that interfered with family schedules. Can't you reschedule Thursday's treatment? Mom asked when it conflicted with Elena's recovery celebration dinner. The family needs to be together for Elena's milestone. Sophia's always making excuses to miss family events, Elena complained when I couldn't attend her beach house warming party. These doctor visits are obviously just attention-seeking behavior. The cognitive dissonance was remarkable. They'd convinced themselves that Elena's routine surgery deserved extensive family support while my cancer treatment was a psychological quirk requiring tolerance rather than medical attention. The oncology team has been very patient with Sophia's anxiety, Dad explained to his golf partners, discussing my treatment as if it were psychiatric care. Some patients need excessive reassurance about minor health concerns. His assessment of my lymphoma as minor health concerns was particularly fascinating, considering his surgical expertise should have enabled understanding cancer staging and treatment protocols. What made their behavior dangerous was pressuring me to skip chemotherapy sessions that conflicted with Elena's social events. One treatment won't make any difference, Dad suggested when my infusion was scheduled during Elena's graduation party. One mistreatment could have meant the difference between remission and progression, but his medical opinion apparently classified chemotherapy as optional when family celebrations took precedence. Sophia needs to learn that family comes first, Mom declared when planning Elena's engagement party. These weekly doctor visits are becoming obsessive behavior that requires intervention. The intervention, they suggested, involved psychiatric evaluation for my supposed medical anxiety, while Elena's appendectomy recovery continued receiving round-the-clock family attention. Tomorrow's surprise visit from my oncology team would clarify which medical situations actually required professional intervention versus family tolerance. The hotel's private dining room fell silent as Dr. Catherine Morrison approached our table with the professional authority that had made her legendary as Chief of Oncology at Massachusetts General. "Excuse me," Dr. Morrison said, her voice cutting through dinner conversation. "I'm looking for the Martinez family. I need to discuss Sophia's treatment progress." The conversation around our table stopped abruptly as Boston's medical elite recognized one of the country's most respected cancer specialists addressing our family directly. "Dr. Morrison," Dad exclaimed, his voice bright with professional courtesy. "How wonderful to see you. I didn't realize you knew our family. I've been treating your daughter Sophia for stage 2 Hodgkin's lymphoma for the past 8 months, Dr. Morrison replied, her tone carrying weight that made her opinions shape cancer treatment protocols nationwide. The festive atmosphere shifted dramatically as nearby physicians processed this information. Stage 2 lymphoma wasn't the routine checkups and medical anxiety they'd been hearing about all evening. Behind Dr. Morrison stood Dr. James Patterson, my hematologist, and Dr. Sarah Chin, my radiation oncologist, the complete treatment team that had been fighting to save my life while my family dismissed my cancer as attention-seeking behavior. "Dr. Martinez," Dr. Morrison continued, addressing Dad with professional displeasure that had made her legendary for holding physicians accountable, "Your daughter has aggressive lymphoma requiring intensive chemotherapy and radiation protocols. Her condition is serious and potentially life-threatening without consistent treatment." The room's attention focused on our table as distinguished physicians realized they were witnessing a cancer specialist confront a colleague about family medical neglect. "I've been trying to reach you for months," Dr. Morrison said, displaying medical documentation on her tablet. "Sophia has missed critical treatment sessions because family members advised her that doctor visits were dramatic and attention-seeking behavior." Charts appeared showing treatment schedules, missed appointments, and progression markers that no competent physician could dismiss as insignificant. "Furthermore," Dr. Patterson added, "your daughter has been attending chemotherapy sessions alone while your family celebrated Elena's appendectomy recovery with beach houses and private nursing care." The contrast was devastating. Extensive family support for routine surgery while a cancer patient underwent treatment in isolation. "Any physician should understand the difference between post-surgical recovery and active cancer treatment," Dr. Chin stated. "Dismissing your daughter's lymphoma as medical drama, while celebrating minor surgery represents fundamental failure of medical judgment." Dr. Morrison addressed the gathered physicians, many of whom served on medical boards controlling Dad's hospital privileges. "Dr. Martinez has demonstrated such poor medical judgment regarding his own daughter's cancer that his competence to treat other patients must be questioned." The aftermath was swift and comprehensive. Within a week, Dad's hospital privileges were suspended pending review by the Medical Ethics Board. His surgical practice faced immediate investigation when colleagues learned he'd dismissed his daughter's cancer as attention-seeking behavior. The medical community's reaction was merciless. Physicians who'd respected Dad's expertise now questioned his fundamental competence after learning he'd treated lymphoma as a psychological problem while celebrating appendectomy recovery. Elena's beach house was quietly sold to cover legal fees when Dad's practice collapsed under professional scrutiny. The family's medical prestige evaporated along with hospital affiliations that had defined their social status. My chemotherapy schedule resumed immediately with full family support, not from genuine concern, but from terror about professional consequences of continued medical neglect. Dr. Morrison's documentation had created an unshakable case of medical malpractice. The treatment team provided support beyond medical protocols, ensuring I received care that prioritized survival over family convenience. My cancer responded well to consistent treatment that should have begun months earlier. 6 months later, my scans showed complete remission. The lymphoma had been successfully treated despite delays caused by family dismissal. Dr. Morrison's aggressive intervention had saved both my life and long-term prognosis. Dad's medical license remained suspended pending ongoing ethics review. Colleagues who'd once sought his consultation now avoided association with a physician whose judgment had been so catastrophically flawed. Elena's engagement ended when her fiancé's family learned about our medical scandal. The celebration they'd prioritized over my cancer treatment became impossible when Dad's professional reputation was destroyed. They attempted reconciliation with desperate appeals about misunderstanding medical priorities. But I'd learned that family members who dismiss cancer as drama while celebrating minor surgery don't deserve access to your medical journey. The oncology team's intervention sits documented as a reminder that physicians who endanger their own children cannot be trusted with other patients' lives. Sometimes the most important treatment removes toxic relationships along with cancer cells. Medical ethics exist because patients' lives matter more than family convenience. When doctors forget that principle with their own children, they lose the right to practice medicine entirely.